How does nosebleed occur? Does it occur naturally or is it caused by a disease condition? Do you know what to do when you or someone you know starts bleeding from the nose? These are some of the questions we're going to be answering in this video. Stick with me as we go through this topic together. Hello everyone, it's your next door nurse Florence and you're welcome to my channel. If you're just joining us, you're welcome to the family. Kindly subscribe, like, share and comment. Thank you. Nosebleed or epistaxis is bleeding from the blood vessels in the nose, and it usually occurs or it's commonly caused by dryness of the nasal membrane and picking of the nose or nose picking. Other causes include trauma to the nose, allergies, nasal infection, sneezing too hard, some medications that prevent blood from clotting like aspirin, clopidogrel or warfarin, excessive stress as a result of hypertension, which causes damage to the blood vessels in the nose due to the extreme pressure in them. Tumor in the nose. The tumor can erode into the nearby blood vessels, causing nosebleed. Hot and dry climate. Hot and dry air can cause cracks in the lining of the nose, causing nosebleed. Alcohol abuse. Heavy use of alcohol can affect the platelets in the blood, which can slow down blood clotting and cause nosebleed. Chemical irritants like cigarette smoke, ammonia or gasoline can irritate the lining of the nose and cause it to bleed. Another cause of nosebleed is abnormalities like deviated septum. A deviated septum is an abnormality that can occur from birth or through injury to the nose. A septum is a thin layer of cartilage that separates each nosary. If the septum is not central, it can cause uneven airflow into the nose, and this can cause one of the nostrils to become very dry and increasing the risk of nosebleed. Clotting disorders. Some genetic conditions like hemophilia can cause nosebleed, and it is usually difficult to stop. Hemophilia is a condition where the blood does not clot correctly due to a deficiency of factor VIII, which is necessary for blood clots. How do you manage or stop nosebleed? You sit quietly and upright or lean forward slightly. You blow the nose gently to remove mucus and blood. With your thumb and your index finger, you pinch the nose firmly for 10 seconds or until the bleeding stops. Breathe with your mouth. You spit out any blood in the mouth to prevent vomiting or nausea. Apply ice by wrapping it in a towel or a clean cloth and placing it on the nose. Do not tip the head back because it allows the blood to run back into the sinuses and the throat. If your nose bleeds often, you can smear a little Vaseline into the nostrils for like twice a day, or you sniff water with a little salt in it to help moisten the nostrils. Eating oranges and tomatoes can also help to strengthen the veins in the nose and help it bleed less. In older persons, bleeding may come from the back part of the nose and cannot be stopped by pinching it. What you do is that you place a wine cork or a corn cob in the person's mouth or in between the teeth. This will help him from swallowing and it will give the blood chance to clot. And don't forget that he will have to lean forward. You should seek medical help immediately if the bleeding cannot be stopped or it keeps occurring, if the blood loss is large or the bleeding is rapid, if you feel faint or weak, and if the bleeding is associated with trauma to the face, loss of consciousness or blurry vision. So guys, click on the like button if you find this video helpful and useful. Subscribe, click on the notification bell so you'll be the first to know when I upload new videos. Share the video as well to your friends and family. Drop your comments in the comment section below and I will attend to them. Don't forget, I'm your next door nurse and I'm just a knock away. I love you guys. See you in my next video.